Hello and welcome to this edition of EC3 HOSA Medical Moments. Joining me today is Terry Bergen, who is the Public Information Officer for the Lincoln Trail Area District Health Department. And we haven't seen you in a couple of months, and since the last time, a lot has changed. So first, Terry, we can remove our mask because we're 6 feet apart here. And you'll be able to hear us a little bit better. Terry, bring us up to date. I know that by the time this airs, it will have already changed again. But how has the area responded in the last 2 months, and what do those numbers look like?
If people are watching the governor's updates, then they know that the last several weeks we have seen some of the highest numbers of new COVID cases than we've seen throughout the whole pandemic since it started in March. And so when we look locally within the Lincoln Trail District Health Department, to date, and this is as of Monday at 4:45 p.m., there have been 14,879 new cases of COVID-19. Okay, specifically in Hardin County, 6,688, and 81 people have died from COVID within Hardin County. If we look at the district as a whole, it's 174 people who have died from COVID-19.
We know that there were spikes, especially in the numbers after Thanksgiving, and also again after the holidays. And like last week, you said was the highest numbers to date that we had.
If you look at, especially one of the things that the governor mentioned in his press release the last week or over the last week specifically, we had some of the highest 3 days highest 3 days of COVID cases throughout Kentucky. If you happen to look at that incident map on kycovid19.ky.gov, you will see that Kentucky is on fire with red counties. And that is the case for Lincoln Trail District Health Department counties as well. Every last one of our counties are red, which means there is critical spread of COVID throughout the district. So it is here, it is spreading rapidly. The holidays and the gatherings of family and the large and small gatherings did not help that. And so we usually see increase in cases because it usually takes 14 days for COVID to develop, about 14 days after an event has happened. And this is, it's no different with the Christmas holidays.
Now, because of the fast spreading numbers and things, the contact tracing has changed some.
And we did that, yes. We had to change the way we had to prioritize contact tracing because of the increase in cases. And so even though we are still doing contact tracing and disease investigating for every new case of COVID, you will get a phone call from the health department. That has not changed. Individuals who are in the household of folks who are confirmed cases will also be spoken to by a disease investigator and our contact tracers, and they will receive quarantine orders. But we do not follow all close contacts anymore. We are enlisting the help of those individuals who are confirmed cases to call family, friends, co-workers, and let them know that they were the case, that they were a confirmed case and that they need to quarantine. As a result, we are not giving quarantine orders to everyone. Now, a lot of people need that letter. And so we have placed on our website, ltdhd.org, which basically stands for the abbreviations of Lincoln Trail District Health Department. If you go to the COVID-19 latest update tab at the very top to the left of the page, click on that. When it takes you to the next page, scroll down and you will see a tab that is in orange, and that is a letter signed by our director that people can provide to their employers explaining why we do not give quarantine letters to everyone who's a close contact anymore.
Now, before we had discussed the wintertime being the perfect storm for both COVID and flu. How have you, and you all also handle flu breakouts. Yes. So has anything drastically changed there? Have we had a mild flu season?
One of the silver linings of COVID, if you can say that, is that our flu cases are really low a decrease in flu activity this year because of COVID. We think it's because of COVID because of all of the preventive steps people have to take to prevent COVID. So the wearing your mask and staying away from people 6 feet or more who are not in your household, washing your hands often, and if all possible, avoiding those gatherings has worked in the sense that it has decreased the number of positive flu cases that we have had in the district. So there's a positive there.
With the flu vaccine, do you get the numbers of how many flu vaccines have been administered in this area?
Now, we don't get that number as far as how many people have been vaccinated with the flu, no. But we do receive the report on how many people have obtained the flu. Now, I do want to specify here that the state only reports confirmed cases that are done by like the PCR, which is kind of like what they do for, kind of similar to the PCR that's done for COVID-19, where you have to have that nasal swab all the way up in your nose. So there's 2 types, the one that goes up into your nose all the way, and then the other ones that's kind of in those nasal nares, which is a rapid. So the flu, when we look at the flu, we only report the PCR. We don't report the rapids. Gotcha. That's what the state does not report, the rapid test. So very low numbers this year.
Let's talk about vaccines.
Okay.
What we've got and what we're doing.
Well, you know what? Let me start by saying that vaccination is an additional duty that the health department has. We are continuing to do the contact investigation. We're continuing to do COVID-19 testing at this point, at least through the month of January, each Tuesday. So just the Tuesday through January, and that may change in February. We are continuing to test people for COVID. And now we have the additional duty of providing vaccines for the public. At this point, we are in phase 1A. We receive a lot of phone calls, such as, I know somebody who received a vaccine that's not in group phase 1A. I think they got it in this county, or this particular county is already immunizing phase 1B. Now, we cannot speak for other health departments or other entities that are providing the vaccine. Lincoln Trail District Health Department is currently in phase 1A, which means that we are only vaccinating healthcare workers and first responders. Now, we were tasked by the Kentucky Department of Health to include first responders as part of the healthcare workers, because they do, in a sense, have that role as first responders. The other thing that I would like to say is that we are going through that list as quickly as possible. We're doing this in conjunction and in partnership with our hospitals. So Baptist Health Hardin, Springview, Flagey, they are also vaccinators as well as the health department. So there are only 2 entities that are providing COVID-19 vaccines right now. That is the local health departments and local hospitals. We are hoping that this will change, where additional health care entities will come on board and provide the vaccine. A lot of individuals want to know if I can get the vaccine from my local health care provider. At this point, you cannot, unless they have gone on that kycovid19.ky.gov website and enrolled as a vaccine provider. Then they work it out with them in the state, and then they could potentially receive vaccine. If they have not gone through that process, then and many providers have not at this point, then they are not as designated as vaccine providers.
Now, individuals that are in that 1A area, is the health department, are you seeking out those individuals? Are you going to locations to do that? Or do individuals need to come to the health department for the vaccine? What's the role?
So what I would like to say is that, and I'm not sure, maybe people have heard about the storage requirements of that vaccine and how it has to be kept at certain temperatures.
And you've got 2 different types of
There
vaccines.
are 2 different. There's Pfizer and Moderna. We have Moderna. That's the one that we have. We don't have the Pfizer at this point in time. Doesn't mean that that can't change. So if individuals are immunized with one particular vaccine, Moderna, their second vaccine needs to be Moderna. There's no intermingling here with these vaccines. It has to be one or the other. So going back to your original question, because of the storage requirements of the vaccine, it's very difficult to get permission to move it. So it is shipped directly to the place where it's supposed to go. And it's housed there at the appropriate temperature because the vaccine is really fragile. And anything outside that temperature range can potentially make it ineffective. And so we like to get it, keep it, and pull out what we need as we need it, as we vaccinate people. And so that's why it's very important that people come to the locations that we provide for them to get their vaccination.
And where are those locations?
Well, I'm going to tell you, I don't want to say right now.
Okay, that'll be fine.
And there's a reason for that.
Well, you don't want to be overrun.
We don't want to be overrun, and there's also security issues around the vaccine and the amount of vaccines that we are receiving. And I'm not sure if you're aware, but some health departments have already received threats related to the vaccine. And so for those reasons, we are not being as forthcoming, not because we don't want to share that information, but because we really are concerned about the safety of our staff who are providing the vaccinations.
Right. So how are they contacted?
So Phase 1A, we have a link on our website that will go down on January 15th at 4:30 p.m. If you are a healthcare provider or first responder who have not received the vaccine, you need to go on our website and register. If you go to the ltdhd.org, as soon as you get to that homepage, there is a red button that says Non-Hospital Healthcare Workers Vaccine Registration. And we are immunizing the non-hospital healthcare workers. We ask that those individuals sign up as part of a group. So we want healthcare provider offices and practices to enroll all of their staff at one time. There's a form that they fill out, and then that goes to the attention of our director, who then calls and schedules them. We will prefer that you not do onesies and twosies. We've had individuals, for example, who work contract, and so they're all over in different counties, and we've asked them to sign up as part, just pick one, pick whatever practice that you're a part of and come with that particular group, if at all possible. It helps us as far as planning purposes if it could be done that way.
Is it safe to say that the 1B individuals will be in that mix to receive by the end of January, or we're looking more in latter part of February?
So the good news is that we are ahead of schedule.
Awesome.
No, that is something that I can share. We were thinking that we would not be able to get started on that particular group until the first week in February. We are hoping that we can get that done before the end of January, Group 1A, so that we can begin on Phase 1B before the end of January.
Of course, it's been a year now that we've been involved with COVID up to our eyeballs, and I'm sure that every other few days it's like, well, we haven't done that. This has been added. This has been added.
Yes.
So you've got to make the tracks for the train to run on.
Yes.
I'm assuming you had to do the same thing with the distribution of the vaccine.
Yes, it's true. And we have to make sure that our staff is competent. And so there's training involved, there's planning involved, there is a lot of things that go on behind the scenes so that when we provide it to the public, it is a product that they can depend upon. We don't want to provide information that changes every 5 minutes. Once we are confident in what we have to say and share with the public, we do that because we don't want people to get confused. I think one of the most common complaints that I've heard about COVID-19 is that the information is always changing. I still hear, we didn't have to wear masks, now we have to wear masks. I'm still hearing that information. Masks don't work. Why didn't they have us wear it at the beginning? There's enough data out there now where we know that masks are very effective. Okay. We are very responsible with the information that we're sharing with the public because of that.
A couple of strange things have happened with the vaccine. But there hasn't been very many bad reactions to it or allergic reactions to those that have been administered? There have been some, and just explain why that might happen.
Well, you know, it's a new vaccine, but I do want to stress, you know, normally it could take up to 70 months for a vaccine to go through the approval process. Moderna and Pfizer was given emergency use authorization by the FDA, but that does not negate the fact that it had to meet certain safety standards. There were clinical trials for both. And I'm going to focus particularly on the Moderna because that's what we're giving. Over 30,000 people participated in those trials. So we have individuals, of course they had a placebo group, but we had over 15,000 or more who actually received the vaccine, and they tolerated it really well. It's because of those clinical trials we know that it's 94% effective. Now, the most common reactions that we have seen is arm soreness. So if you've had a tetanus shot, you kind of know what I'm talking about. Some people have minor arm soreness. Some people have, it's a little bit more severe in the sense that it may be so sore you can't lay on it. And so what we're recommending folks do in those situations is to take what they would normally take if they had muscle soreness at home. And that usually seems to work. Other potential side effects are people can get headaches, muscle aches, joint aches, chills. Those are, when you look at those clinical trials specifically, those are the ones that happen most frequently with that first vaccination. To date, we really haven't had anyone have an anaphylactic reaction to the vaccination that we've provided. And we have provided over 1,400 vaccines of the Moderna vaccines so far.
Why is it important to get the second vaccine, and how close to the first does it need to be?
So the first vaccines provide some protection. Your body begins working on those antibodies with the first vaccine. The second vaccine takes you to that 94% effectiveness rate. And so that's why you want that second one. The Moderna vaccine is 28 days from your first. So it's very important that you follow up with that 28-day second dose to ensure that you get all that the vaccine has to offer. Now, I do want to say this, Gina. We've had individuals call and say, hey, I need to reschedule the time that I get my second dose of vaccine. It's very hard for us to do that, okay? I mentioned, and I alluded to this a little bit earlier, we're doing disease investigations, we're doing COVID testing, and we're vaccinating. And we are a very small health department. I know we cover 6 counties, but when we're looking at staffing, we are kind of small and mighty, is what I want to say. And so we really don't have the flexibility to offer people different times because we have to be able to immunize them on the days that we have given them because we just cannot. It's just, with everything else that's going on, it's very important that people follow up on the return dates that we give them and not try to reschedule.
There's some individuals that don't necessarily need the vaccine, or you're worried about the vaccine. Talk about pregnant women or young people, that kind of thing. Individuals who should not or should talk to their doctor before getting the vaccine. Who can you tell? So
with the Moderna vaccine, it's only approved for those 18 and older. So that's an age group limit there. We are not providing it to women who are pregnant and women who are breastfeeding. If someone, and it's really hard to say at this point, if you've had a severe allergic reaction to COVID-19, or if you have a severe allergic reaction to components of the vaccine, it's a contraindication. A lot of this is because there's just not enough data and studies to see how the vaccine, what effect the vaccine will have on that particular population. Now, what's great is that we have, and I mentioned the hospitals before, Baptist Health Hardin, Springview, Flagey. If individuals come to to receive a vaccination from us, and they are unable to do it because of a contraindication, we have a relationship with the local hospitals that allow us to refer them to the local hospital upon their verbal consent. That allows the vaccine, those individuals who are at higher risk for complications, to receive that vaccine in a more clinical environment. And so that's what we're doing. We refer them to the local hospital, and the hospital then calls them to set up an appointment to come in and receive the vaccine in a more clinical environment.
Wonderful. We've been talking vaccine, and it seems like we've lost the discussion about testing, having testing. Has our area, we're still supposed to be testing as much as possible, correct?
If you have been exposed to someone who has COVID and you develop symptoms, yes, please talk to your healthcare provider or go and get a test to determine if you actually have COVID or not. Now, there has been some new guidance that has been that was changed by the the Center for Disease Control to assist with compliance. Because, originally it was if you were exposed, if you were close contact, you have to quarantine for 14 days. Let me say, before I tell you the new guidance, is that is still the gold standard. The Centers for Disease Control still recommends if you are a close contact to a confirmed case that you quarantine for 14 days. Now, this new guidance applies only to individuals who are close contacts. So, individuals who was within 6 feet for 15 minutes or more, cumulative 15 minutes or more of a confirmed case. So the confirmed case directly coughed or sneezed on them. They hugged or kissed or had some type of physical contact with the confirmed case. These are the close contacts that I'm talking about. The new guidance applies to those individuals who are close contacts and who have absolutely no symptoms. That's key. So, if you determine that you are a close contact to a confirmed case, you have a couple of options. And I'm going to re-stress this again. If you're around 14 days is the gold standard. You should really quarantine for 14 days. If you are around high-risk populations, you should quarantine for 14 days. That is the recommendation. If you are a close contact who has no symptoms, you should wait a minimum of 5 days before you get tested. Because, as you know, it can take a while if you test too soon, the viral load may be too low and the test may return negative. The CDC recommends at least 5 days pass from last day of exposure. So please don't run out and get tested on day 1 and 2. Wait. 5 days or more, you get tested. If that test is negative and you still have no symptoms, you can be released from quarantine. You quarantine for 7 days, you're released on day 8. Okay. You decide, I don't want to have a test. Your other option is, if you have no symptoms, is to quarantine for 10 days. If you have no symptoms, you can be released on day 11. Those are the new guidelines for close contacts with no symptoms.
Okay. In regards to testing, we've been told there's a quick test and then there's a test that takes a little bit longer. Again, just for our audience, what's the difference in those?
So that rapid test, you get the results that day, within minutes, actually, a matter of minutes. And with the other tests, it can take 2 to 3 days for you to get your results back. A lot of individuals have had a rapid, tested negative, had a PCR or the test that takes 2 to 3 days, and tested positive. If we had to determine which one to use, we always use the gold standard, which is the 2 to 3 day test. Right. Okay, and so that testing, as we mentioned before, individuals who still require testing, that is still going on. We offer testing. If they want to go on our website, they can actually make an appointment for testing. As I mentioned, we only do it on Tuesdays in January, each Tuesday of the week in January, and I'm not sure at this point if it will continue into February.
I'm assuming neither you or I have a crystal ball. So the things that are in place to keep us healthy, mask wearing, social distancing, hand sanitizing, those kinds of things are going to be with us
for a long time.
A very long time. Probably the rest of this year until we get to a point in terms of vaccinations.
Yes, and please, I'm glad you brought that up, Gina, because a lot of people think, oh, I got the vaccine, I'm good. No. You still need to wear your mask, physically distance, wash those hands often, avoid those large and small gatherings. You are still required to do that, so please do. The vaccine is not a get out of jail free card. You have to continue to do those preventive health measures that protect you and other people.
And that also applies to someone that's had COVID.
Yes, that's exactly right. They really do. And you know, a lot of people wonder, this is another point, I'm going on these rabbit trails. So a lot of people wonder, well, I've had COVID, do I need the vaccine? They are recommending that individuals who've had COVID, that they be vaccinated. As of right now, individuals who have COVID, there is, even though it's rare still, there is a potential for reinfection after 90 days. And so having that COVID vaccine, you know, just helps to maintain and build up those antibodies to protect themselves from getting severely sick.
Awesome. For our audience, remind them of the important information they can find on your website.
So if you're wondering about the phases and where we are, because a lot of people are, we receive a lot of phone calls about, I have a parent that's 70 or 80 and they're high risk. When are you going to start phase 1B? Look to our website. Look on our social media pages, ltdhd.org. We're going to be putting a banner on our website today that will display what phase we're in and when we're moving on to the next one. We ask, if you call, we ask that we're hoping that people will go to the website instead of calling, because all we are going to be able to tell them at this time is that we're still in phase 1A. We're going to be moving on to phase 1B soon. Go to our website. And so that's what we want folks to do. Just keep checking back, looking at that website. As I mentioned earlier, we're ahead of schedule, so we should be moving on to phase 1B very soon now.
And again, you're also emphasizing that healthcare providers outside of those hospital settings can also register.
They can, but that will go down. That registration link will be removed by 4:30 p.m. on Friday, the 15th of January. I think that's Friday. The 15th of January is the day they need to keep that in mind. So if you have an office or a practice that has not signed up to receive the vaccine, please do so now.
Okay. And the other form that's located on the website deals with isolation, or the idea of self-containing. So, and what's the purpose again of that particular item?
People have questions about the vaccine and how it works. They should go and look around. There's a lot of good information. But to your point, to the form, now that we're not the letter, now that we're not issuing quarantine orders to all close contacts, a lot of folks are calling us asking for a letter that they can give to their employer. They can find that letter on our webpage. It's an orange button that they can print off. It's signed by our director, and it explains that we're no longer following all close contacts and we're no longer issuing quarantine orders for everyone.
Okay, great. Anything that I have not touched on or you haven't touched on, Terry, that you'd like to mention?
Be patient with us. Please be patient with us. We are trying to get through these phases as quickly as possible. The health, as I mentioned before, the hospitals are a great partner. They're vaccinating as well. We are hopeful that other people will enroll, that vaccine enrollment become vaccine providers, such as pharmacies, so there will be other options as we continue on. Not sure when that will be, and that will kind of change the game a little bit as far as accessibility. The other thing I want to stress too, Gina, is that how quickly we go through the phases depend on how much vaccine we have and how many people we have to vaccinate in each phase. So it's very important that people please keep that in mind. There is 53,000, the governor mentioned 53,000 doses for Kentucky.
Right.
And so it has to be shared across 120 counties. So please keep that in mind. The vaccine availability, how many people in each phase will determine how soon we go on to the next.
Okay, great information, Terry. Thank you again for joining us. We'll need to get together in February too
Okay.
to kind of wrap up these to go over the new details. So
yes.
Thank you again for
You're
coming.
welcome.
And thank you for watching at home on this edition of EC3 HOSA Medical Moments.